Dr. Dave Johnston, how are you?
Great, Dr. Amit Pawa. How are you?
Very good. I'm so excited to be able to catch up with you. It's not like we speak to each other via WhatsApp about 10 times a day or anything.
I feel
Listen,
like I know you better than I know myself.
so listen, I'm introducing you today with a couple of hats on, with three different hats on. So you were instrumental to our successful Belfast 2019 meeting, and you were, key to organise the symposium there, which is brilliant. You're a speaker at this year's meeting, but more importantly, you're kind of the brains behind or the mastermind behind the way we're going to deliver this meeting. So thank you for all of the hard work that you're putting in, and I thank you on behalf of everyone who's going to be tuning in. What I wanted to ask you was, number one, how are you managing to do that whilst being an anaesthetist and doing a normal job? And number two, what are you most looking forward to about the meeting and why people should join?
Thanks, Amit. Yeah, well, I guess the first question, you just take a day at a time and see and just plan it as you go along. I think related to that, for the second question, we've seen in Belfast just the idea of the symposia, how well it went down, because people really liked that atmosphere where you're presenting very common clinical scenarios where you encounter those every day and addressing those to experts in the field to address to see what would they do in a particular environment, what block would they opt for, how would they do that in terms of a very practical, pragmatic way. So no highfalutin anatomy, groundbreaking papers and lots and lots and lots of slides. This is like the rubber hits the road. This is exactly how the experts would do a block or approach a regional technique for a particular scenario, with maybe a little bit of extra frill in for the interest for, like, if there's a complication or if there was a consideration which might preclude you to do a particular approach. So just very, very practical facing scenarios. And that's kind of what my most interesting part is for this RA UK. We've got a fantastic panel of experts and speakers, and they will have so much information to share with our audience. Probably particularly, I'm pretty looking forward to the trauma focus moulage. It's going to be it's going to be off the hook.
Oh, well, that's brilliant. Well, I tell you what, that's a teaser if ever I heard one. I mean, having seen your symposia guide and what we've got lined up, I think there's no doubt that day one's going to kind of blow everyone's socks off, and day two, we've kind of got so many different topics. We're covering such a wide range of things, so there'll surely be something to kind of keep everybody entertained, I think.
Yeah, well, I think off the back of that, because in day two our program is so packed, we've we've shortened the talks to be kind of really punchy and content, filled with lots of succinct nuggets of really good information. So particularly for the virtual environment where a lot of people kind of are a bit zoomed out with a lot of the virtual conferences. But what we want is to maintain people's attention, to kind of hit them with lots and lots of information, but also in a very succinct way. So there'll be something for everyone, regardless of what your practice is, regardless of what your normal field of anesthetics involves, that there will be stuff for you in both day one and day two.
So that's brilliant. I mean, I think that's about as great a selling or as great a promo plug that I could hope for. So the last three questions that we've been asking all of our 5 minute interviewers: favorite upper limb block, favorite lower limb block, and favorite trunk block.
Okay, so favorite upper limb block. Like, if I say this, it'll probably be half, most like 3/4 of the RAEK experts won't want to speak to me at the meeting. But infraclav is not the best block since sliced bread. It isn't. Supraclav is the way to
Oh
go.
no! So supraclavicular for you.
Supraclav, if you get right down onto the first rib and you squirt a little bit to lift the plexus off, and you get right in between that groove, just as you squirt some local anesthetic to split the upper divisions and the middle divisions, and you get some local anesthetic between those divisions, you've got the best block.
So you're talking about an intraplexus hydrodissection type technique, or how is your local
Yeah,
anesthetic? Yeah, so that used to be my favorite, but I don't know, maybe controversial. I don't know, maybe we'll put
I
it
know, I
to
know. Like I said, that's not going to go down well with most of our faculty, but I have to say, they work quickly and they're very reliable. So yeah, I'm sorry everybody, it's a super for me.
Don't apologise. It's an opinion, and you're a professional, so we value it. What about lower limb?
Lower limb, my favorite block has to be the Dr. Canal femoral triangle block. You achieve such bang for your buck for an easy block, an approachable block, a well tolerated block, and a reproducible block in nearly every patient. It's very easy to teach. You get a lot of value for what you deliver, and for any surgery on the knee, it gives you so much. So for me, femoral triangle blocks, closely followed by an IPAC as a close number 2.
And that's really valuable information coming from you, because you do a lot of knees, so that you're talking from experience. Okay, and then last but not least, and I'm just curious as to whether I'm going to hear one of the quadratus lumborum blocks here. I'm curious to know what your favourite trunk block is.
I struggle with coming up with one, and I was not looking forward to asking me this. But if I could, am I allowed to pick a paravertebral for a trunk block? Because,
yeah, of course, it's a trunk block.
All right.
Yeah,
a paravertebral block, again, because the utility and the versatility of a paravertebral, right up and down.
Did you say power vertebral? Power
vertebral. You're always done. Paravertebral, bilateral paravertebrals, for abdominal surgery, for chest analgesia. It's the most versatile, I think, and gives you a lot of, again, bang for your buck. Probably more advanced than other truncal blocks, but I think whenever you have that natural progression from an ESP, a midpoint transverse process block, and then landing in with the paravertebral, also amenable for catheters and an intermittent bolus technique, a paravertebral block gets my vote every time.
Well, you've definitely made me a happy man, because I was waiting for someone to say that. Yeah, it's brilliant.
I thought I'd lost you with the infra bash in there, but I think
no. Back in. DJ, thank you so much for joining me. I'll let you get on with the rest of your day, and look forward to seeing you at RUK 21. Take care. Bye bye.
Look forward to seeing you there. Cheers. Bye bye.
Bye.